Hi, my name is Jay Patel, and today I'm making a video in order to answer Unit 2 pathway questions. So, to start, the first question I chose was from Case Study 3, and I'll read the question and the prompt out before I begin answering the question. So, in Case 3, it states, a 5-year-old boy is brought to the pediatrician's office for an annual visit. The mother reports that he's been a sickly infant and often appears drowsy. She also has concerns over her son's persistent thirst and frequent urination. Blood samples are taken for insulin measurement at times 0 and 1 hour after glucose loading. The results of the testing are illustrated in the table below, which you can see if you go back and open up the PDF for the case questions. So the first question that they ask is, what is the information likely to suggest about the underlying biochemical basis for the patient's symptoms? So when looking at the data, you can see that the initial baseline blood sample for the patient is found to be at 0.8. This number is significantly less compared to the normal value, which you can see to be around 6. Moreover, an hour after the glucose load is administered to the boy, the serum insulin level is found to be at 5. This is still significantly low when compared to a normal value of being around 40. Increased thirst and urination are also a big factor in this situation because the increased thirst and urination can be underlying factors signifying possibility of type 1 diabetes. What would you predict the patient's fasted blood glucose levels to be given his current condition is the next question. So, for example, above normal range, within normal range, or below normal range. So I answered a fasting glucose test along with an oral glucose tolerant test. The boy's initial glucose levels would show to be above normal range if these tests were administered. And then finally, the last question for case 3 asks to list 2 regulatory enzymes that are likely to be active in the individual's current condition. There are several regulatory enzymes that exist to be active in the individual's current condition. Many are active during the hyperglycemic state. The process of glycolysis houses several of these regulatory enzymes itself. These enzymes include many of the ones that we learned about within our Unit 2 lecture PowerPoints. These include hexokinase and pyruvic kinase. Moreover, these enzymes, they also help function in regulation and catalytic roles within the body. So most of the information that I found for case 3 was easy to find with a little research. Most of it can be found from lecture notes, and Mayo Clinic, the page that they have for hyperglycemia was a really good source in understanding how the disease works and just analyzing the question altogether. The next question that I chose to answer was for case 4. So I'll begin by reading the prompt. A previously healthy 2-month-old female presents herself to the hospital with jittery spells several hours after breastfeeding. The mother reports that she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports that these symptoms began starting. Laboratory results are consistent with hypoglycemia, which is low blood glucose, but are otherwise unremarkable. One of the main points is that epinephrine was administered and there is no increase in blood glucose whatsoever. However, there is an increase in blood lactate levels. A physical exam reveals a liver edge about 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirms hepatomegaly, or enlarged liver. Blood glucose levels increase after breastfeeding, but she can't maintain the blood glucose levels within a normal range during fasting. Based on this information, I'll be answering the question, which is, which of the following is the most likely diagnosis of this patient? So I'll start off by reading the options. The options are A, hereditary fructose intolerance, B, galactosemia, C, glycogen storage disease, which is the inability to use glycogen, and D, glucose 6 phosphate dehydrogenase deficiency. So when examining the question, you got to look at every option and analyze it and just basically use process of elimination. It's best to utilize what you know and what you don't know to rule out answer choices that may not be correct. So choice A states that the girl may have hereditary fructose intolerance. This is incorrect because the disorder for hereditary fructose intolerance includes symptoms of nausea, vomiting, abdominal pain, gas, chronic fatigue, and malabsorption of nutrients. So none of these symptoms are symptoms that the baby had, so therefore A cannot be the correct answer. Furthermore, choice B, which is galactosemia, is also incorrect. This is because symptoms of galactosemia include vomiting and loss of appetite. Vomiting and loss of appetite were symptoms that were not mentioned in the prompt whatsoever, so therefore the child does not have galactosemia. Option D, glucose 6 phosphate dehydrogenase deficiency, is also incorrect. The symptoms of this disorder include having dark colored urine, yellow eyes and skin, and pain within the back and abdomen. Once again, none of these symptoms are found in the child. Therefore, the correct answer is C, which is glycogen storage disease, or the inability to use glycogen properly by the body. All of these symptoms are spoken about in the prompt and match symptoms related to this disease. So a majority of what I researched came from studies conducted by the Genetics Home Reference. So Genetics Home Reference is a reputable government source, and they just have information about just a whole bunch of diseases and conditions that the human body can undergo. So this is where I found most of the information for this case question, along with finding out the symptoms for glycogen storage. The symptoms of glycogen storage I learned from just in the notes, and there was an article posted by Johns Hopkins Medicine, which was actually really informational, where I could find a bunch of the information. But for the most part, the information regarding the symptoms of hereditary fructose intolerance, glycogen storage disease, dehydrogenase deficiency, they all came from this source of Genetics Home Reference. So therefore, because of all this is why the girl had glycogen storage disease, or the inability to use glycogen.